Heart and lung diseases are big killers, and we know that, like most things in medicine, early diagnosis offers the best chance of cure. So it's exciting to work with St. Joseph's, who are bringing a new way to look at CT scans of people's hearts and people's lungs. St. Joseph's are embracing technology and bringing artificial intelligence to the patients. And what this will do is look at heart scans and lung scans in a way that an expert can't do with their own naked eye. And it will give metrics, quantified metrics of lung and heart health that we can track over time. The lung check takes a low-dose, non-contrast CT scan of the chest, and it looks at it three different ways. Number one, it scans through the images and it identifies nodules. Nodules may be the precursor to lung cancer. The other thing that the artificial intelligence technology will do is it will look for areas of damage in the lung, potentially due to smoking, and it will quantify how much of the lung is damaged in that. And it will identify areas of scarring, and it will tell us how much of the lung is damaged by scarring. Having these pieces of information takes a patient's scan and their report from a subjective assessment by an expert to an objective metric that we can document and we can monitor. If we think about lung cancer, we think of it as sort of a lump or a mass or a shadow in the lung. That lump or mass will have grown from an abnormal cell to start with, and what we're trying to find is the nodule, the smallest size that we can detect it and track the change. So this can allow us, first of all, to make sure we detect them all, and then when we do detect them, we can get accurate volumetric measurements and track them over time if needed to ensure that the patient gets the best treatment for those. The heart health check takes a standard clinical CT scan of a patient's heart arteries, and whilst an expert reader will look at those heart arteries for areas of narrowing or furring up that may be causing the patient's symptoms, what the artificial intelligence innovation does is it looks at the scan in a way that we can't look at it with the naked human eye. It looks at a signal around the blood vessel, and that level of inflammation may be the precursor to patients even developing coronary artery disease. When you get the results back, there are a couple of metrics that you'll get. So number one is your carry heart risk score. That is your risk of dying from a fatal heart attack in the next 8 years. In addition to that, you'll get three other numbers, and those will be the levels of inflammation around each of the three major blood vessels that supply the heart muscle. And those numbers will be plotted against what is normal for a patient of your age and your gender. So we will know whether you are average, above average, or below average. We can use those numbers to figure out whether you should continue just with a healthy lifestyle with diet and exercise, or whether you need certain medications to help reduce your risk. But importantly, what we can then do is further down the line, after an appropriate time interval, we can reassess your risk and to see whether those recommendations have had the effect and the impact that we hope they will do. It's hugely exciting to be at the cutting edge of imaging and imaging analysis, to use technology to our benefit, to benefit patients. It's really a privilege to be part of.